Has anybody ever tried to rate a tornado?
And I would like to know why you can never get to the end of a rainbow.
What's the worst disaster in Iowa?
What are your top 3 movies that involve weather?
Welcome to Weathered Questions, where we answer the questions on your radar.
All right, everyone, welcome into this week's edition here of Weathered Questions. Myself, meteorologist Kaj O'Mara, alongside meteorologist Jan Reichert. We have been waiting for this day for a long, long time. I kind of teased a little bit about this back in December, that we were hoping and we were waiting that we might be able to get a medical professional on this show to answer all those questions that Jan and I are not qualified to answer. We did it. Yes, we have on the podcast this week Dr. Tim Segers from Mercy Care Physicians. Dr. Tim, welcome to the program. Can you give us just a quick, maybe 30-second or 1-minute overview of how long you've been practicing, sir?
Absolutely, and thank you both for having me. I've been looking forward to this as well. I'm really excited about our conversation. I have been practicing primary care medicine now for almost 25 years, if you include my residency, so a long, long time. And I did my medical training at the University of Iowa, hospitals and clinics way back in the day. Graduated there in 2001 and then completed my residency and have been in practice ever since. And this is a really interesting topic for me. Kai knows I'm kind of into weather, but I also I answer weather questions in regards to health almost every day. This is a much bigger topic than I think people know. Everyone's interested in how weather affects them. And so I'm really excited to have our conversation today.
Yeah,
Good.
and I think that's exactly the nature of our podcast at large is it's those weathered questions, right? It's the ones that you keep getting asked over and over. And so we were very happy to hear that these aren't just questions that we're like, oh, that relates to, we should have a doctor on. We should have somebody who actually has medical background to answer these. They are ones that you're getting asked on a day-to-day basis. So
Yeah.
I think let's get into it with the first one. And this is one that I personally do not encounter, but I've heard a lot myself throughout my meteorology career and also just my professional life beyond. So let's talk about when weather changes and people say, oh, I know it's going to rain, or, oh, I know it's going to storm. My elbow hurts, my knee hurts. Is there any truth to joints hurting and weather changes?
Yeah, no, there absolutely is. And in fact, this is probably one of the most common questions I get. In fact, in the spring when we have severe weather or in the winter when winter storms roll in, I'll have an elderly person in the office and I'll mention the weather because that's a topic of discussion always. And people look at me and say, oh, I know it's going to snow or I know it's going to rain because they're feeling it, But this has been something that honestly, it's a very fascinating topic because there is real science behind this. It is a real phenomenon. In fact, I'm kind of a medicine history geek, but Hippocrates wrote about this. He wrote a paper way back, I think like 400 BC.
Wow.
And it was called Airs, Waters, and Places. And he refers a lot to the effects of weather, especially weather in different geographical areas, and its relationship to health. So this has been something that people have been looking at for a long, long time. And it is a growing area of investigation, especially as weather and climate changes. And we start to understand the implications of those changes on human health. And so, yeah, it's been going on for a long time, the research in this. And then there's actually a really cool study. In fact, it's all medical studies have really funny, goofy names sometimes. But this was a study done in the UK back in 2020, and it was literally called the Cloudy with a Chance of Pain study. And it was a really well done study. They looked at like 10,500 people, and they studied the effects of wind, temperature, and barometric pressure on pain. So people with migraines, people with joint pain, people with fibromyalgia. And again, they reinforce what we've been thinking about for a long time, and that indeed changes in pressure approaching weather systems and barometric pressure changes do drive pain in all these patient populations. It's really a complex thing, actually. Our joints specifically, if we could focus on maybe joints, and we all get aches and pains here and there. And as you age, as a 58-year-old guy, believe me, the joints pains are real.
That's what I have to look forward to, apparently? Is that what you're saying?
Guaranteed, man.
Okay.
Guaranteed.
All right, continue.
But yeah, talk about weathered. My joints are weathered. But It's a really fascinating physiologic phenomenon. People have postulated for a long time about how and why that happens. But if you think about your joints are an enclosed space. So your joints are actually a cavity, although small, and your joints are filled with a really viscous or thick fluid called synovial fluid. But it's sealed in there, so it's a sealed compartment, and it actually is a negative pressure compartment. So whatever the outside pressure is, atmospherically, our joints are about 6 to 8 centimeters of water pressure less. And so it's a negative pressure space, which is how the fluid in there kind of works. It's a very thick fluid. Think of it like hydraulic fluid. And as pressure changes and even some temperature changes can affect the consistency and the movement of that fluid in the joint. And that drives a lot of the pain associated with barometric pressure changes. So when the pressure outside drops, that makes the pressure in the joint actually higher relative to the outside pressure, and that causes discomfort. And there's other things that go on too. The joint, the fluid doesn't move around the same. So kind of this hydraulics, which I won't even pretend to understand. It's above my pay grade. But there's also changes in our joints. Our joints have all kinds of receptors. We have receptors in our joints that tell us about pain. We have receptors in our joints that tell us about position. And some of these receptors live in a part of our bone just under the surface of a joint. So when two bones come together, that articular surface where those two bones come together, there's cartilage there. The cartilage helps protect the end of the bone. But in arthritis, that cartilage gets broken down. And that layer of bone just under the cartilage is called subchondral bone, and it's full of nerve receptors. It's a really sensitive area. And so when pressure changes, temperature changes occur, and that fluid moves differently, or there's pressure changes that affect that part of the bone because the joint's damaged, the pain can be quite severe. And it's a really big deal. And it's not just elderly people that experience this. There are younger people that experience this joint phenomenon too. A lot of athletes, young, even professional athletes that have tons of wear and tear on their joints, they're really susceptible to this type of pain. And so it's a real thing. The other thing that happens is barometric pressures change. Our tissues contract and expand differently. And so when your soft tissue is affected by pressures differently, it can cause pain too. And it's something that, every day we're all walking around. We don't really pay attention what the barometric pressure is. If you're young and healthy and don't have bad joints, you don't know if it goes up 5 or 10 centimeters of pressure, whatever. And so it's something that, for the most part, healthy people or people with normal joint structure really don't experience. But there's effect on other pain syndromes too. People with fibromyalgia have more pain when pressure changes. People with migraines are really susceptible to weather changes. In fact, if you talk to migraine people, they'll tell you, well over half of them will tell you, yes, weather changes are a big trigger. We call the things that cause migraines to start, we call those migraine triggers. And they'll tell you that migraines often are triggered by changes in weather. Even temperature changes, barometric pressure changes, all that kind of stuff. And so
it isn't only pressure. It does come back to temperature and other factors too.
Yeah, in fact, the research out there, they look at everything from temperature, humidity, and humidity has big influences on other health problems. We may get to that today. We can riff on that a little bit if you'd like, but the old saying, it's the humidity, stupid, that kind of thing.
Yep. Oh yeah.
But no, so all that's the one thing that doesn't seem, all the kind of parameters of weather we all think about, usually when they do really comprehensive weather studies, they look at wind too, and wind's never really been shown to be a factor. It'll blow people over and they'll break something, but as far as everyday health, probably not a big thing. But with migraines and things like that, there's changes in pressures in the sinuses and different cavities. We also have pressure sensors in our brain. The tissues that line inside our skull that line our brain, they have pressure sensitivity or pressure sensors as well. And so we're wired more into the barometric pressure than we probably know. Unless you have one of these problems, then you're well aware.
So here's a quick little follow-up then, because my wife will tell me a lot, and I've got a backyard weather station. She'll say the pressure's changing, and she'll point to her head. So she might get a migraine once every 3 months, like she's not going anywhere. Otherwise, she is fine to get through her day. But lo and behold, I checked the weather station, and has there been any science behind, is it the way the pressure changes, like the amount of change over time, or does it always need to be dropping or always need to
Yeah,
be rising? What do you
yeah,
think?
that's an excellent question. The question always is it a matter of the velocity of the change in the pressure, like how
Yeah.
quickly it
Yeah.
changes? Is it the degree or the quantification of the pressure change? Is it 10 versus 20 centimeters of pressure? Uh, what seems to be the biggest trigger is just a pressure change, and it's always negative. So when pressure drops, that tends to be
Interesting.
because again, going back to some of my earlier comments, it seems like when that happens, the pressures in our joints and in these other receptors, it tends to go up relative to outside pressure as the outside pressure drops. So, interestingly, though, Kai, when you talk about your spouse, generally people who have much more frequent migraines are much more tuned into the weather. So, the more frequent your migraine, so if you're on one of these
Interesting.
unfortunate people that deals with a migraine twice a week, you're much more likely to be susceptible to weather triggers than people that maybe have a migraine twice a year, kind of thing. So, and I think there's still active, ongoing research around this. I think, again, as we watch weather patterns and climates change around the planet, I think there's going to be more and more work done on this. But
Okay, cool. So we've talked about kind of the physical pain now. Let's shift slightly to something just a little bit different. And this is more about our mental health and weather patterns. So we've talked now about physical pain with air pressure changes and a wide variety of things you just stated. What about certain weather patterns, like a prolonged cloudy period, for example? Does it actually impact our mood or mental health, or is that just like a placebo thing? Is there any science that backs that up? Like if we don't see sun for 10 days, do we really see any sort of mental change because of that?
yeah, no, this again, this is a very real phenomenon. When you get 21 days of clouds in January in Iowa,
Yep.
we always have
That's what I
that
was thinking
prolonged,
about. Yeah.
yeah,
Yep.
that cloudy spell in January. Everyone kind of gets in, air quotes, a funk.
Mm-hmm.
But that's a real thing. In fact, that kind of seasonal affective disorder, or SAD, that's a real phenomenon, and that is triggered by light. And there's science behind that. When we see less light, when we're exposed to less light, just ambient, what I call outdoor light, we make less serotonin, and serotonin has big influences on our mood. In fact, a lot of the medicines we use to treat mental health problems is serotonin-based medicine. So there's a big role for that chemical messenger in our brain. And there's no doubt now, the science is pretty strong that the less light you're exposed to these different wavelengths of UV light outside, the more likely you are to have changes in your mood. And it's funny because when you read some of the literature around this, the folklore is, well, yeah, everybody gets kind of melancholy on a rainy day, you know. But the researchers, there's been research done on that here in the United States and in Europe, and the rainy days really don't do it. There's no change based on the number of rainy days. It's not rain, it's just the lack of light.
Mm-hmm.
So cloudy, rainy day, if you have 21 in a row, it's going to affect your mood. And that seasonal affective stuff is much more prevalent than you know. I mean, that's up to 10% of the population at any given time.
Oh, wow.
Yeah, and I think any of us, even if you say, well, I don't live with anxiety or seasonal affective disorder,
Yeah.
most of us, if we have a few days of clouds, we kind of get funky. You just feel more down, more out, maybe more tired, that kind of thing. So when you looked at that, the research around that is pretty interesting as well. They looked at cloudy days with precipitation, cloudy days with wind, all that kind of stuff. Sunlight is a predictor. So the number of days without sunlight has a direct impact on how our moods change and all that kind of stuff. In fact, interestingly, and this is research not that old, I just ran across this recently. They did a lot of studies in Nordic countries that have tons of cloudy, crappy days,
I was
And
just
these
going to
people
ask
are,
about that. With
they're
like the
happy.
different
Oh, yeah.
latitudes.
Yeah,
Yeah.
no, they're happy. They're happy, because, and I think a part of it is they get acclimatized, or, in some ways they have cultural adaptation to that because they go out and do things in the winter.
Mm-hmm.
In Iowa, during those 21 days of bad weather in January, we just kind of hold up in our house. We watch football, we do whatever. They go out and they cross country ski and they do things, they engage their environment. So they're outside. And I think that makes a big deal. And so, my advice to people in the wintertime is get out, enjoy it, be part of it,
Yeah.
And I'm sure we may talk a little bit about cold weather and its effect on your health. And because your mom said, don't go out in the cold, you'll catch sick, that kind of thing. But That is a wives' tale. Cold doesn't make you sick per se. So I think the seasonal thing is really a real problem. In fact, I would tell you in my clinical practice, I definitely, just anecdotally, I see a lot of change in the wintertime, in the dark months when people come in and they're just really struggling. Maybe these are people that live with some mental health issues, and then the cloudiness brings it out. But so I think it's kind of a multifactorial thing. That, and where we live, we just don't go out and do a lot in the winter except shovel snow.
All right, so we need to go cross country skiing, get outside and
Yes,
enjoy,
that's
and
right.
we will all feel better. All right.
Although
Well,
I do not support the Arctic plunge. I think that's just dumb.
Dr. Tim
okay.
does not like the polar vortex. We'll write that down.
That's
He
right.
does not like that.
So you kind of alluded to it there. Do we want to throw in a little extra bit about, does cold weather actually make us sick?
Yes, well, for fear of the wrath of millions of mothers across the country, it's okay to go out in the cold without a stocking hat on. Okay, so you're not going to die of pneumonia if you go out in the cold. But no, cold weather has direct and indirect impacts on health, but it's not kind of what we think about. Like when you're a child and your mother said, "Don't go out without your hat on. You're going to catch sick," all that kind of thing. Cold weather drives health outcomes in a couple of different ways. The most important thing, especially I think where we live in a temperate environment like the Midwest, when the weather gets bad outside, what do? We go inside. We get together with family and friends. We hang out. We stay home. On a snowy night, we don't go out because meteorologists like yourselves tell us to stay home. So we stay home. And that adds to health problems because when we're home, we're more likely to communicate disease to each other. We're more likely to spread virus and bacteria to each other. And so when we're together more, and in the winter, when you're in the house, we tend to sit in the room, watch TV together, watch football together. And so it's much like we're going to spread disease. Now, cold, dry air also has some direct impacts because viruses, for instance, which is what drives most of the disease that we deal with in the winter, almost 90% of what we see with illness in the winter is just viral illness. Doesn't mean you don't feel bad, but it's usually not bacterial kind of stuff. And that's why everyone gets frustrated when the doctor won't give them an antibiotic because it's a virus. But the viruses do respond to cool, dry air. The drier the air is, viruses can live longer. Viruses move through drier air better.
Really?
In fact, rhinovirus, which is a family of viruses that cause a lot of common cold stuff that we all get, they prefer the cold. They reproduce better in colder temperatures. And there's some evidence that when you're out in cold, dry air, like your nasal passages are a little cooler, and that may promote better adhesion of viruses and that kind of thing. And so there's definitely some temperature and humidity considerations for how viruses spread and that kind of thing. But as far as going outside, you're going to catch cold. Not really. You're actually more likely to catch a cold when you're setting inside confined with other people. So that's something to think about. Obviously, there's risk with cold exposure, hypothermia, frostbite, that kind of thing. Those are real direct influences of cold weather. But those
You're
are
not going
things that
to
are
get a cold from being
Right.
yes, yeah,
Right.
exactly. So
Interesting.
your mom lied to you. That's the message about
Oh,
cold.
no.
Yeah.
All right, my mom's listening, so
Mom-
I-
Yeah,
your mom's
Jan's mom
listening.
is listening. I can promise you that.
All your
right
moms
now.
listening, please Google this before you tell your grandkids.
So let's do a quick pivot because we're halfway through meteorological spring now. We're looking ahead to summertime. And this is one thing that ails me personally. And it's not so much a bothering thing. It's just kind of unique. And for whatever reason, my daughters do it and my wife does it. So if we go shopping and it was kind of overcast earlier and the clouds are breaking, I get out of the car and the sun is out. 3 seconds, I'm blowing sneezes. And as soon as I go, my daughters go, bam, bam, bam. Why? Why does that happen?
Well, first of all, rest assured, It's very common. It's very normal. There's nothing seriously wrong with you, Kai.
Okay. All right.
You're
Good.
all
That's
right.
comforting.
That's
Yeah.
good.
So for the first time, no, it's actually a real thing. It's called the photic sneeze reflex. It's a real thing. It's been studied for a long time. It's actually got a cool name. Like they've developed this name for it, this syndrome. And I'm not being funny here. They call it a CHOO.
No, they don't.
CHOO.
What?
Yeah.
No, they don't.
Yeah. It stands for autosomal dominant compelling helio-ophthalmic outburst.
Amazing.
Now,
Science is wonderful.
even though this is a podcast that has not been fact checked, you can't make that stuff up.
I just Googled it. It's right.
Yeah, and it's actually been studied for a really long time. I talked about Hippocrates earlier. Aristotle actually studied this. He wrote a paper called The Book of Problems, and he hypothesized that when you went out in hot sunny weather, it made the inside of your nose sweat, and that's why you sneeze. So Aristotle actually commented on your problem. And now I want to make
Is
you
that
feel
actually
good
what
about
happens?
this. What's that?
Is that actually what happens? Is their nose
No.
sweating? Oh, okay.
No, it has nothing to do with that. He wasn't too far off, but no, this is actually an inherited condition. So this is a truly, if you remember your high school genetics, this is a truly inheritable condition. It's autosomally dominant in its inheritance, which means if one of your parents carries the genes that lead to this problem, you have a 50% chance of having it yourself. What happens? I don't think we know for sure. I get this question so often in the clinic. Why do I sneeze when I go outside? So I would challenge all of you listening that if you have this problem, the next time you walk out in the bright sunlight, close your eyes. You will not sneeze. So this is nothing to do with your nose directly. It has to do with visual stimulation to your retina. And so without getting too geeky in the science and the biology of this, or the anatomy, I should say, when you walk out in bright sunlight, and we all do this, and you should, when you walk out in bright light, when you're exposed to brighter light, your pupils constrict to limit the amount of light entering your eye, right? That's why we don't stare directly at the sun. We can't handle all that light. But when that happens, it triggers, we have these little areas on all of our nerve collections called nucleus. And the nucleus that triggers and is responsible for your pupils getting smaller, it sits right next to a nucleus that when it fires, it makes your nose secrete more and it makes blood vessel dilation in your nose. And it's thought that is why you trigger. So Aristotle wasn't far off when he talked about the inside of your nose is sweating.
Wow.
It's not really doing that, but your body's responding like the inside of your nose is hot and it's sweating. So he wasn't too far off. So it's felt to be, think of it like your nerves that deal with bright light and your nerves that deal with your nose lining are crossed. And when one fires, it triggers the other one to fire, and that's why you sneeze. Huh. So I'm not surprised, Kai, that some of your children have the same thing, just based on the genetics of this problem. It hasn't been studied a ton because it hasn't been studied a ton because it's a benign process and no drug company can make money off it. So there's not going to be a lot of studies on this topic. Although it affects, there's studies done in Asia, Europe, and the United States on this. It affects like 1 in 4 people. The prevalence is anywhere between 18 and 35%, depending on the study. So about 1 in 4 people.
Wow. That's a lot.
So
That's a whole
it's
lot.
a lot of people. In fact,
wow.
If you called it a disease, it'd be one of the more prevalent diseases.
We're all infected.
People. Yeah, 1 in 4 of us. But not a dangerous problem. But interestingly, if you can walk outside in the bright light safely, maybe have your wife hold your hand and keep your eyes closed, you'll see that you will not sneeze, because without the ocular influence of the bright light, you won't sneeze. So it's kind of a cool thing, actually, how our body.
It's worth an experiment at home, at least.
But then you're just going to be walking around like without being able to
My
see
neighbors
it
are going to be like, what
Especially
in the
if the whole
world is
family
wrong
has
with
it.
him?
Yeah, don't walk into a street sign or something while you're...
No, don't walk in the road. My gosh.
Yeah, for sure.
Oh, wow. Well, I have learned a whole lot today. And I think we do still have some more questions. So maybe we can do another follow-up here at some other point potentially. But
yeah, we may have to do a part 2 on this later in the summer.
I would love that.
Because just so the audience knows, we didn't even get to half the topics that we had in the rundown. And I think this was awesome. This
It was wonderful.
outstanding. And I think
Yes.
everybody listening has learned a ton. I have learned a huge amount, especially the joint stuff. That was remarkable to hear you. And I was just visualizing like why sometimes things hurt, and it makes total sense.
Yep.
And my
great.
doctor's advice to everyone listening in regards to the joint pain in the weather is just don't get old. Stay young forever, and that will not be a problem for any of you.
Problem solved.
Yeah, problem solved. There you go. Yeah, exactly.
All right. Well, we'll work on that as we can, right? We'll maybe leave the anti-aging up to the medical professionals. But as soon as you've got that, you let us know, Tim.
I will.
Tim,
If I figure that out, I'm going to invite the two of you onto my podcast. Okay.
great.
That
Great.
sounds like a plan. Deal.
Okay, all right.
That sounds wonderful. Well, thank you so much for joining us today,
You're
Tim.
welcome.
This has truly been wonderful. Like I said, we both learned a lot. I hope everybody else learned a lot. If any other medical weather kind of joint questions have come up for you, be sure to write in weatheredquestions@gmail.com. You can join in on the conversation and let us know what's on your radar as always. Until we talk next week, stay safe.